Nosology. So I am going to discuss about ICD-11, International Classification of Disease 11, in describing nosology clinical features, and we will see about course. So bipolar 1 disorder means it requires occurrence of a manic episode, okay, or a mixed episode. At least one episode of mania or mixed affective state where you see both symptoms of mania and depression in the same episode. For both these episodes, duration should be at least for 7 days unless treated. And episodes of depressive episode are not required for the diagnosis, but most of the patients experience major or minor depressive episode in their lifetime. And episodes represent a significant departure from the individual's baseline function. Okay, so because in childhood there are lots of other developmental disorders like ADHD and disruptive disorders like conduct disorder (ODD) that may present as behavior disorder. Okay, so the child will have chronic behavioral problems. To diagnose as bipolar 1 disorder, the episode required significant departure from the baseline functioning. Okay, baseline, if a child is already having behavioral problems, bipolar 1 disorder will be diagnosed only the behavior is significantly high from the baseline behavior. And typical onset is young adulthood or late adolescent, as I was describing before. This is about bipolar 1 disorder. Bipolar 2 disorder, here unlike bipolar 1 disorder which requires only manic episode, it does not require depression for a diagnosis. Bipolar 2 disorder required periods of major depressive episode, at least one episode, and a hypomanic episodes where episode lasts at least for 4 days. And there should not be any full manic episode or mixed affective state. Okay, here there should not be any manic episode or mixed affective state. If it is present, it will become bipolar 1. So when the manic episode or mixed affective state is not there, it requires at least one depressive episode and one hypomanic episode for the diagnosis of bipolar 2. Rapid cycling course, 4 or more episodes per year. If any mania or depression or bipolar 2 hypomania or depression, if there is more than 4 episodes in a single year, then that is called rapid cycling course. So what are the clinical features of manic episode? So here as per ICD-11, both of the following features, that is extreme mood state and increased activity, occur concurrently and persistent for most of the day, almost every day. For, as I was telling, it should be present for at least 1 week unless shortened by treatment. Unless treated, it should be present at least for a week. These two symptoms, an extreme mood state or increased activity. The extreme mood state may be euphoria, irritable mood or very expansive mood, and it should represent significant change from the individual's typical mood. Here, if the child is previously normal, there is no disruptive disorder or baseline irritability that is present, then it is easy to diagnose a manic episode because it will have a very distinct mood that is different from the baseline mood. But if the child is already having behavioral disorder or ADHD, the irritable mood or expansive mood should be distinct. So there should be significant change, increase in intensity from the baseline mood, at least for 1 week. And commonly you see rapid changes in the different mood state. For example, the child will have very irritable mood and suddenly have subtle depression, which will present as brief crying. And we need not diagnose as mixed state because there is lability. Lability is part of a manic episode. Okay, mixed episode as described later will be diagnosed only there is a complete criteria of depression in the same episode along with the manic episode. Here lability does not warrant the diagnosis of a mixed affective stage. It is common in manic episode. And increased activity again should be distinct from the individual's typical level. Again, the confusion comes when there is when the child is already having ADHD. ADHD, the child's baseline itself, they will have lots of hyperactivity. Here, the significant activity, especially goal-directed activity, that is distinct from the baseline. So you can diagnose manic episode. So there should be an extreme mood state and significant increased activity at least for 1 week time. This is presenting along with excess talkativeness or pressure of speech. They will be completely talking without any interruption. Flight of ideas, that is switching from one topic to another topic. They will start talking about one topic and suddenly they will get distracted and start talking about another topic, and they will keep switching on from one topic to another topic. And increase self-esteem and grandiosity. So they will have heightened self-esteem. They will start telling things which is not humanly possible, extreme grandiose. And decreased need for sleep. In a manic episode, they may sleep only for 2 to 3 hours per day. It need not be present in all children, but there is generally decreased need for sleep. And reckless behavior, increased goal directed, I want to do this, I want to do that, and high risk behavior, increased sexual drive and high risk behavior. These are all part of the extreme mood state and increased activity which is present at least for